Do you as a person know where your provider is taking their healthcare waste? Our healthcare waste management systems are in total disarray. Are you aware that if they are dumping it into the common domestic dump sites, that they are putting your health at risk? Hospitals and healthcare provision are major polluters of the environment. We produce not only normal waste, but also the biohazardous waste. And being biohazardous would cause a lot of diseases and even the risk to the population, especially given our country where there are some people who collect and recycle waste from the domestic waste sites. And if there was medical waste in that, then it could easily cause very serious illnesses.
The issue of healthcare waste management in the country, despite the fact that there have been initiatives and efforts to be able to fast track, I don't think we can say that we have done very well. Improper management of healthcare waste exposes the population to quite a number of risks.
We have challenges, particularly in the rural areas. The small health centers treat it just the same way they would treat normal waste.
I've been pricked with the needle when I was packing my waste. Automatically, first you will feel bad because this one is an hospital. Maybe the one who has used the sharp contains some infection.
The biggest challenge is whereby you find clients come to you, you sign a contract with them for compliance, because for a hospital to be open or a clinic to be open, they need to show that there is somebody who will handle their waste. Once you sign this contract with them, they take it for compliance purposes, but then they don't give you the waste.
This issue of healthcare waste has come to light. There was not much exposure with regard to information that is related to health waste management.
Waste has actually tremendously changed. At this point in time, what we have cannot be compared with what we used to have some years back in the 60s. We are embracing on all those who think of what it takes to work with us.
We have come to an agreement on how to work together. The issues of the environment are immediate and they affect people.
We thought, being in healthcare, we should take a leading role in helping, in a little way, the society and the communities that we work with in removing this waste from going to the domestic waste management and manage it properly the way it should.
We see a lot of potential from the private sector. So we would like to use the knowledge, the technology of the private sector. GIZ core area especially is capacity development for our partner organization. We are working closely with the health sector, and the project is also implemented through the health program. We try really to build capacity in this organization so that the sustainability of the project in the future is also assured.
The waste management is actually covered under the Public Health Act rules of this country. We have gone further to develop some small policies that are supposed to come out and give a crystallized way of how we perceive where healthcare waste should be managed in this country.
We have waste management regulations, waste management guidelines 2006, which is also encased in EMCA, Environmental Management and Coordination Act of 1999. Our engagement with healthcare waste is with regard to licensing of incinerators. We license incinerators, and also those that do not have incinerators, we usually want them or wish to have them use other licensed operators.
What we had planned to do, we've been able to achieve what we set out to do. One, now we have the guidelines on healthcare waste management. Put up incinerators in these towns and incinerate waste for the hospitals and the clinics. It's a huge equipment. It's probably the largest in East and Central Africa. Since we started in January, from January to August, we've incinerated more than 35,000 kilos. The capacity of our incinerator is 200 kilos per hour. For me, this is an exciting moment because it means then we'll be able to help other clinics and hospitals who will be having the challenges of how to manage their health waste. We also trained the people working with these transport companies in how to handle the waste and also to know what to bring here. Because it's not just a question of incineration, there's a process from how this waste was transported, how it is received, how it is stored, and then how finally it is incinerated, and how you even remove the ashes finally.
Nairobi Women's, in conjunction with GIZ, has trained us. They have given us the convenience and that cost reduction so that we are able also to pass on the same to the client.
We trained not only the transporters how to handle the waste better, we also trained the institutions where this waste is being generated, and especially in terms of segregation of the waste, so that then it's only that biohazardous waste that is then brought in for incineration.
Uchafu kulingana na hospitali tunaelewa, sababu unakuta kuna karatasi tatu, kuna karatasi ya yellow na red na black. Hii ya black unaweka chakula na hii ya red unaweka gloves na vitu damu, alafu ya yellow ndio unaweka sharps ndani.
To the healthcare provider, this is a cost, but this is the exciting part, and this is where the business opportunity is. With the devolved government, now most of the healthcare provision is going to be the responsibility of the county governments. So we as Nairobi Women's Hospital see a big opportunity to work with the county governments, and then at the same time, maybe work with the national government because there are certain hospitals that are going to be maintained at the national level. As a private organization and as private investors, this being a cost to the business, we realize that it also makes business sense to manage other people's waste. And therefore, the model is that we get the waste from the institutions through transporters, and then we incinerate on their behalf and they get to pay us. So it's a business in that we make a profit out of it. But also, the most important thing is not even the profit. The most important the issue is about where we are helping remove this waste that would have gone to the usual regular domestic dump site.
Our broad basic business in this country is to provide good health. It is to enhance good health to our population.